turning her hand over in an anatomical position so that the radius and the ulna are parallel. I'm just going to get a hold of them, and I just want to check for this kind of movement. I just have that feeling, and actually energetically it's this. Mm-hmm. I put my hand above this and it's like this kind of movement. It's like, no, it's this kind of movement in the Lynn, right? Mm-hmm. So, right? Mm-hmm. For some people, it might be the opposite. You know, we show you the radius and ulna teeter-totter, right? Well, this is a sort of a slip and slide instead. Oh, yeah. All right, so let's just go back to the 3 waves, which we did, right? And check for. Now that this connection is set, then I can start to work with the radiocarpal joint. And as you all know, really this joint, it's the scaphoid that rocks on the distal radius that produces this nice movement here, deviation of this.
At least it's moving.
Yeah.
Wasn't it you, Greg? Greg, didn't you?
Yes.
Yeah. Wasn't I working with you on the wrist?
Well, that first night, the general release, we did do briefly touching with the wrist.
Yeah, and my wrist wasn't moving. I don't remember who it was that was working. It wouldn't move.
It was 1,000 years ago. And the ulna, there isn't a relationship, right? You know that, right? The ulna doesn't really have a joint with the carpals. It's all about the radius and the carpals. The ulna is just, I'm sorry. Okay. Alrighty. So, it's just general work. Starting out with general work because if I start with general work, then there's fewer details to touch on afterwards. And always really important to compress towards the radial carpal joint and not towards the floor. Oh.
That's good.
And as Arthur would say, there's a little tear trickling out of the eye.
I always get that. It's very common for me. Yeah. Even in Alexander technique, and anytime I'm laying down on the weight, tears on that side.
And now it seems like pronation is way easier than supination.
Yeah.
Interesting. Okay, relax your elbow. Thanks. And see the shear? See that? Arthur would call that wrist slough.
Wrist slough.
Yeah. I remember he worked with a lot of massage therapists, you know, many of whom, especially back in the 70s and the 80s, trashed their wrists because massage schools didn't really teach proper ergonomics for the practitioner back then. Mm-hmm. I can remember, whoa, there we go.
I think mine's from Kalinetics.
Maybe.
Supporting people's heads.
Oh, sure.
I had to modify how I do it because of my wrist.
Yeah. I mean, back in the day, I didn't know any better. I would do massage down the back like this. You know, and I developed an underride, really, on the wrist. So I find, especially with massage therapists, you can get a lot of slot. That's much more tone. Good. Thanks.
Yeah.
These are just all general movements. Ah, there we go. So I think of this as the hula hoop maneuver, just as a way to integrate, to kind of wiggle it all around. It's like stirring your coffee. Here's the coffee cup. And you stir it with, you get, now. Ow.
No?
Ow. Her lunate is really prominent. That's this bone here.
I've gotten 2 ganglion cysts there in the past when I was pregnant, but I haven't had them since.
Yeah, now the lunate has a relationship with the capitate here. Okay, the capitate is this kind of like oblongish bone. This is a capitate. Lunate comes in like this. Lunate cups the end of the capitate, and that allows us to move our wrist like this because there's this saddle joint there. So that movement in the wrist is all in.
Yeah.
Yeah. So the lunate, I've got to hold a lunate. And no. Yes, right?
Mm-hmm.
So I'm twirling it towards me. I call this a push me, pull you, because I'm pulling it towards me as I push it away from me.
Mm-hmm.
So.
Mm. Yeah.
I'm also doing a little bit of distraction away from her radius and ulna with this. Very slight.
And would you ordinarily, or just that it's appropriate here?
It seems important right now.
Okay.
But I never know.
Yeah.
I mean, I might be, this is what it would feel like with no distraction, and it's just not happening for you.
It doesn't feel good on the lower point.
Right. The other thing I want you to notice is that I've also got contact with her middle metacarpal, which has a relationship with the capitate. So essentially, capitate's in the middle, right? Capitate's right here. I'm twirling the lunate end and a little bit of distraction on the metacarpal end.
Mm-hmm.
Okay, so that's mechanically what's happening here. It's a nice one, huh?
Mm-hmm. Yeah, I guess it's been jammed in there for just a few years.
Yeah. Oh, yeah. So let's start. There it goes. Okay. The lunate is the most commonly displaced carpal bone. There we go. And now, see, you've got this nice freedom in radial and ulnar deviation. It wasn't the scaphoid. This problem wasn't the scaphoid. In your case, it was the lunate.
Okay.
If it was the scaphoid, though, the scaphoid's over here. So, like, if you do slide your hand over to the side, this little bump here, that's the scaphoid, because it glides along the end of the radius here and pops out. It's the most commonly fractured bone in the hand, especially among some of my favorite cyclists, because when you crash and you come down on your hand like that, you can crack it. It's a common fracture. In this case, Lynn's body, your scaphoid, is a little bit more towards your palmar surface.
Uh-huh.
If I push here, it's a little cranky.
Yeah.
Did you get her face? Get her face. Cranky.
It doesn't like that at all.
You curled your lip in the most delightful way.
It says,
It was like a little, I don't know, it was good. Anyway, so her scaphoid is deviated a little bit towards the palm side of her hand. I'm going to get my small crescent wrench out, hook that scaphoid, and take it further towards her palm, and I'm going to counter-rotate with the thenar the other way. And the angels sing. I'm not adding any additional compression, and in this case, I'm not doing any distraction either. I'm just cranking it. And that, if I let go, what would happen? It would boing back. So I don't need any additional compression. The proprioceptors are getting lots of information for this. And Lynn is, your body suddenly feels different.
I feel it to my feet.
Yeah. There we go. There was a little click there.
Mhm.
Don't know if the iPhone got it, but now how's that feel?
Yeah, it has a. It doesn't have an uncomfortable feeling like it did before.
Yeah.
I still am not as aware of it as I am of other things.
Yeah.
It's really interesting.
Okay, so now,
Yeah.
like, it's like a bobblehead in here now.
Wow.
That freed up. So the lunate and the scaphoid seem to be big players when people feel like their wrists are stuck. So we exaggerated by shearing the wrist flop, the 3 waves, rotation, ulnar and radial deviation, and supination and pronation there. But we also did the setup with the slip and slide for the radius and the ulna to make sure that everybody was meeting down here. Because the relationship between the distal ulna and the radius, even though the ulna is not a player in this joint, the distal ulna, I think, is a player in supporting the radius in its starring role at the wrist, is how I think about it. But you guys probably know more about anatomy than I do, so if I say something that's really not right, you tell me. Okay. So, see how that feels.
Oh, wow.
Wonderful.
Oh, yeah. Wow. Just feels good to actually, like, be in an end range, which it doesn't usually. There we go. There. Just integrated even better.
One of my practice tricks and tips is that after I work with something, I'll say to the client, give that a test drive.
Mm-hmm.
You know, take it around the block, kick the tires, you know.
Just integrated the whole.
And what happens is then when they start to give it a test drive, all that integration happens and they're in control of it, and that's usually when the osseous release happens, when you get the little clicks and the little pops. And then it's like, ba-da.
Yeah.
How does your hand feel now?
Oh, satisfied.
So actually, maybe in your case, it was all about your wrist.
Maybe. I mean,
Yeah.
I wasn't, like I said, I wasn't aware of anything uncomfortable. It wasn't bugging me. Just that it felt like maybe it was less aware than the rest of my body, perhaps.
Look at you. You're like a little kitty. So just to review. Oh, she's waving. Okay. She does a lot of waving. So basically, all I did were the 3 waves, the wrist slop, the slip and slide for radius and ulna, and then we checked preferred position of the scaphoid. Now, if her scaphoid was deviated towards the back of her hand, I'd press and wrench it, probably in this position I'd use my thumb as the wrench, and wrench it towards the back of the hand and counter-rotate the thenar in the other direction. Okay? You may also need to do that same maneuver between the radius and the scaphoid, because sometimes that's what needs to release. So I take the scaphoid into its preference and counter-rotate the radius in the opposite direction, like so. Okay? And then the lunate release, which is, I've found more and more really, really important. And it's sort of like the lunate capitate complex. Capitate being the carpal that meets the middle finger, the middle metacarpal here.
This just feels so different.
It's a big, long, ovalish sort of bone here. And on the palmar surface, all these guys, the hamate and the trapezium, all those bones kind of curl around it. So it's way more accessible here than it is on the palm side. Although you could exaggerate that. Plus, and that's what allows us to do this movement, right? So anyway, getting a hold of that middle metacarpal, a little bit of distraction, getting a hold of the lunate and either spinning it away from you or spinning it towards you, and then hanging out waiting for the release. That's the lunate release. And then integrate. Okay?